The National Health Regulatory Authority has put vigorous efforts to implement the directives of the Kingdom of Bahrain to promote the health sector and strengthen the regulatory system. In 2018, NHRA was able to complete 92% of the 2018 operational plans, where several initiatives and plans were implemented and considered as an important cornerstone to ensure the delivery of high-quality services based on international standards.
ما توج به إنجاز الهيئة من حصول الهيئة على جائزة الملتقى الحكومي في 2018 لأفضل الممارسات الحكومية، وهو تطبيق برنامج الاعتماد الوطني والمعني بتقييم جودة الخدمات الصحية المقدمة في المؤسسات الصحية، ولكنه هذا حصيلة إنجاز طوال السنة لضمان تقديم الخدمات الصحية بطريقة آمنة وموثوقة بها. وإحنا رؤيتنا تتضمن أن يكون في خدمات صحية آمنة وذات جودة عالية. نريد أن ننطلق بالبحرين، مملكة البحرين، للتنافسية في مجال السياحة العلاجية.
The number of professionals registered with the authority in 2018 was 30,621 compared to 28,000 in 2017, with an increase of 9%. The Professionals Regulations section completed 2,486 new license applications, with an increase of 23% over 2017. The number of registered health facilities in the Kingdom of Bahrain was 716 compared with 671 in 2017, with an increase of 7%, including 21 hospitals, 95 public centers, 41 specialized centers, and 132 clinics. NHRA inspectors conducted 697 inspection visits and corrected 1,350 violations. The number of medicines registered with the authority amounted to 3,170 medicines, and the Department of Pharmaceutical Regulation completed procedures of temporary registration of 3,391 drugs. The number of licensed pharmacies in the kingdom reached 263 pharmacies, an increase of 23% over 2017. The efforts of the medical device team resulted in the authorization of 8,696 medical devices and equipment worth a total of 27,573,000 Bahraini dinars. In order to register all the medical devices used in the kingdom, which will facilitate the importation and tracking process, the authority has established a new system for registering medical devices with a total of 346 registered devices. 125 violations were detected in import equipment and 20 non-matching devices were withdrawn. On the other hand, the Continuing Education and Research Unit has approved 19,672 continuous medical education programs and 4 clinical trials. The Complaints Unit received 172 complaints and 30 cases, and the technical committees completed investigations of 64 complaints and cases. The National Accreditation Program is one of the most important initiatives implemented by the authority, aiming to improve the quality of health services in the Kingdom of Bahrain. NHRA worked closely with all healthcare facilities to achieve the desired quality standards and was able to accredit 16 hospitals and 6 centers. An important national role and great responsibility carried out by the National Health Regulatory Authority in pursuit of ensuring safe and high-quality health services delivered to all citizens and residents of the Kingdom of Bahrain.